Hi all. So in this video we're going to see about examination of reflexes. So this video is especially meant for first year MBBS physiology practical examination. So here basically I'll be talking about how to do this for an examination and what are the different minimum theory knowledge that you should know behind this examination. Now mind you, different institutions may have minor variations in the examination pattern. So here basically I'll be discussing the general principles that are given in the standard textbooks. Now if there are variations, you have to follow your institution. Okay. So in most colleges for the examination, for any clinical examination for that matter, you will be asked to write the format. So for examination of reflexes, you have to write the general examination, then you have to write the higher functions because it's a part of CNS examination. Whatever question comes from the CNS, you have to write about the higher functions also, and then move on to the reflexes, examination of reflexes. So reflexes can be classified into superficial reflex, deep reflex and visceral reflex. Under superficial reflexes we have the corneal reflex, the conjunctival reflex, the palatal reflex, the pharyngeal reflex, the abdominal reflex, the plantar reflex. Okay. We also have chromastic reflex, but it is not done routinely, right? Now under deep tendon reflexes, we've got jaw jerk, biceps jerk, triceps jerk, supinator jerk, knee jerk and ankle jerk. And under visceral reflexes, we've got the reflexes of micturition, the reflexes of defecation and reflexes of sexual function. So now we'll see each one by one. First, we'll talk about the superficial reflexes. Now, why is it called superficial reflexes? Because we are stimulating the superficial receptors. So, that is the difference between the superficial and deep. For superficial reflexes, the receptors are superficial. So, that is why it is called superficial reflexes. So, first reflex that we are going to discuss is the conjunctival reflex. So, to do this reflex, the procedures you have to always, not only for this reflex, for any examination, you have to stand on the right side of the subject, and then you can ask the subject to look at a distant object, or you can ask the subject to look at a distant, focus on a distant object. Okay. And then you can use a twisted wisp of cotton. See, you just have to twist the end of a cotton so that you get a wisp of cotton, and using the wisp of this sterile cotton you can approach from behind. See, you're not supposed to poke the eye directly, you have to gently bring it from the side, supporting your fingers on the cheek of the patient, and gently touch on the conjunctiva. Okay, so that white portion of the eye is the conjunctiva, you can gently touch there. So what will happen? Obviously there is going to be bilateral closure of eye, the patient is going to close both the eyes. So the points to remember is that the subject should, you have to stand on the right side, the subject should look at a distant object, and then bring the wisp of cotton from behind or from the side. Okay, and then you have to touch the conjunctiva. Clear? So then you will get bilateral eye closure, that is the effect. So what is the pathway for conjunctival reflex? So the reflex pathway is, the receptors are the touch receptors on the conjunctiva. The afferent limb is via the ophthalmic division of trigeminal nerve. The center is the pons, which is the nucleus of trigeminal nerve. And the efferent limb is the facial nerve, which is going to cause the contraction of the orbicularis oculi, which is in turn causing closure of the eye. So this is the reflex pathway of conjunctival reflex. So the next reflex is the corneal reflex. So for corneal reflex, the procedure is same as that of the conjunctival reflex, except that the position that we're touching is different. So here we have to lightly touch the lateral corneal edge, or which is also called the limbus. Okay, so here in this picture, you can see that limbus is actually the outline or the junction between the cornea and the conjunctiva. So you're supposed to touch at the limbal area of this eyes for observing the bilateral closure of eye. So here the effect is also the same. The only difference between conjunctival and corneal is in the site of touch, which is limbus for corneal reflex. Okay. The reflex pathway is also similar. So the receptors are the touch receptors on the limbus. The afferent, efferent, center and effector muscle all are same as that of the conjunctival reflex. Right. Now next we've got the palatal reflex. So in palatal reflex, to demonstrate that, we ask the subject to open the mouth widely. Okay, and then we touch on both sides of the patient's mucous membrane. So here we touch at the palate of the patient, we touch on both the sides using a swab. Okay, and once you touch here, it triggers the reflex contraction of palatal muscles, which causes sudden palate elevation. So something like the gag reflex. So you have the contraction of all the pharyngeal muscles which are causing the sudden elevation of palate. So what is the pathway? So the receptors are the touch receptors on the palatal mucosa. The afferent limb is the glossopharyngeal nerve and the trigeminal nerve, and the center is the vagal nucleus in the medulla, and the efferent limb is the vagus nerve. So it is through the vagus nerve that the palatal muscle gets contracted. So that is how we actually do not routinely do it, but this is you have to know this much about palatal reflex. What about pharyngeal reflex? In pharyngeal reflex, the location of touch is different. Here we touch the posterior pharyngeal wall. See, here in this part, in the posterior pharyngeal wall, we touch using a swab, and it causes elevation contraction of the pharynx. The reflex pathway is similar. The afferent limb is a glossopharyngeal nerve, center is a vagus nerve, efferent limb is vagus nerve, and the effector is the pharyngeal muscles. So that is how we do the pharyngeal reflex. What about abdominal reflex? So in abdominal reflex, to elicit that, we have the subject to lie down in the supine position. We ensure that the abdomen is muscles are well relaxed, and then using a blunt object, you gently stroke on the abdominal skin from lateral to medial. So see from here, lateral to medial on all four quadrants, we stroke the abdominal skin. So if there is a lesion on one part, or if the muscles are paralyzed, the umbilicus position will not be central. The normal abdominal muscles will pull it towards its direction. So based on where the lesion is, you can have the weakness on any part of the abdominal muscles, in which case the umbilicus will not be central. So here again, we are looking for the contraction of the abdominal muscles causing umbilicus to deviate towards the stimulated area. So that is how we do abdominal reflex. So in this case, you have the main thing to remember is the direction in which that we have to stroke in all four directions from lateral to medial. Clear? Now we have the very important test, which is the plantar reflex. So to depict the plantar reflex, you have to have the subject lie down in the supine position. We ensure that the lower limb muscles are relaxed, and then we have to fix the ankle joint. So this is very important. You have to fix the ankle joint firmly with one hand, and then using a blunt object you have to stroke the lateral border of the sole. So see, this is the direction. We are going to stroke the lateral border of the sole from heel to the root of little toe, and from there we extend it medially to the base of the big toe. Up to the base of the big toe we have to stroke. So from here through the lateral border we go up and then go to the side. So what will happen? So normally we'll have plantar flexion of the big toe and plantar flexion and adduction of the other toes. So all the toes will actually come together. That is the normal plantar response. So the center is L5S1 segments. The root value is L5S1. The afferents and efferents are through the tibial nerve. Okay, so the center is L5S1 of spinal cord, which is very important question, and the afferent and efferent travel through the tibial nerve. Now here you have to also know about the abnormal plantar response. What is the abnormal plantar reflex? So this is typically seen in pyramidal tract lesions, in which there will be dorsiflexion. See here, there is a dorsiflexion of the big toe, okay, along with extension and fanning of the other toes. See, all the toes have just extended and they are fanned out. So that is why this is also called the extensor plantar response, or the Babinski sign. In Babinski sign. Okay. Now the only other condition where this extensor plantar response is considered normal is in children under 1 year. In such cases, the extensor response is considered normal. So all these are the points you have to know about plantar reflex. And finally, we've got the cremastic reflex. So to elicit the cremastic reflex, we abduct and externally rotate the patient's thigh, and then we gently stroke on the upper and inner aspect of the thigh. Upper inner aspect of the thigh, in which case the testicle on that side will move upward due to the cremaster muscle contraction. So that part, the testicle will move upward due to contraction of the cremaster muscle. So here again the reflex pathway is the afferent is a femoral nerve, the center is L1 L2 segment, the efferent is the genitofemoral nerve. Okay, so that will complete our superficial reflexes. So we've seen the corneal, the conjunctival, the palatal, pharyngeal, the abdominal, plantar and cremasteric reflex. Okay. So now we'll move on to the deep tendon reflexes. So as I said before, deep tendon reflexes are called so because we are going to stimulate the deep receptors. Basically, we are going to stimulate the tendons, strike the tendons of these to elicit these reflexes. So the different deep tendon reflexes we already mentioned that. So what we have to know is the physiological basis for this. So the physiological basis for all tendon reflexes are the stretch reflex. What was stretch reflex? So stretch reflex is basically this arc here. See, whenever we stretch a tendon, what will happen? That stretch will be recognized by this muscle spindle which is present inside the muscle. Okay. So this stretch of the muscle spindle will be sensed by the sensory nerve here and will reach to the spinal cord. And from there, through the motor nerve, it is going to cause the reflex contraction of the muscle. Okay, so this arc is the cause for stretch reflex. Okay, so stretch reflex is basically an involuntary muscle contraction response to stretch. So this is the pathway. It is mediated by a reflex arc with the afferent, which is sensory, efferent, which is a motor neuron, and that is just one synapse. It is a monosynaptic reflex. Now that is another difference between superficial and deep tendon reflexes. Deep tendon reflexes are monosynaptic reflex. So just like grading of muscle power, the deep tendon reflexes also have a grading. So if it is absent as in case of an element lesion, then we say it as 0, grade 0. If it is decreased, we say it as 1 plus. Normal or brisk reflexes is 2 plus. Hyperreflexia is 3 plus. Hyperreflexia with clonus is a 4 plus. Okay. So what clonus is, we'll see as we move on. So first we'll see how to elicit the jaw jerk. So to elicit the jaw jerk, you have to ask the subject to slightly keep his mouth open like this. And then in this area that is between the lip and the chin, you can keep your finger and strike on that using a knee hammer. Or another method is that you can directly percuss in this area with your forefinger. Okay. So either way, what you're going to check is for you're looking for any reflex closure of the jaw. Normally, there should not be any closure of the jaw, which means an absent reflex is considered as normal. So jaw jerk will be present or it will be exaggerated only in cases of upper motor neuron lesions above the fifth cranial nerve nucleus. So if there is a lesion, if there is an upper motor neuron lesion above the level of the fifth cranial nerve, then you will get reflex closure of the jaw. In such cases, we tell that the jaw jerk is exaggerated. Okay. And what about the pathway? The afferents or efferents pass through the trigeminal nerve and the center is located at the pons. So this is how you can elicit the jaw jerk. So the next jerk, which is a very important jerk, is the biceps jerk. So how do we elicit the biceps jerk? So again, now this biceps jerk is commonly kept as an auscultation also. So in this case, you have to stand on the right side of the patient, and then you have to keep the elbow flexed at a right angle, okay, with the forearm in a semi prone position. Okay, so in this position it's at right angle and it's at a semi prone position. Not only that, it should be supported by the examiner's forearm. So see here, the examiner is supporting the forearm. This is the examiner's hand and the patient is actually keeping his or her hand over the examiner's forearm. So this is how the position should be. Okay, and you have to place the examiner's thumb on the biceps tendon. So here you can see that the examiner's thumb is on the biceps tendon. Okay, and then we strike the examiner's thumb with the knee hammer. So you're not supposed to directly strike over the biceps tendon. You are actually striking on the examiner's thumb. So see here, the position is very important. It should be at right angle, semi prone, resting on the examiner's hand, and the examiner's thumb should be on the biceps tendon. And also observe how the examiner has placed the knee hammer. See, you have to hold it at the end of the knee hammer. Okay, so you have to hold it like this and then strike. Okay, now what if the patient is lying down? In that case, the examiner need not support the arm because already the patient is in a lying down position and the arm is supported on the body itself. So in that case, you just have to keep the arm flexed at 90 degree and then keep your thumb there and then strike over your thumb. So this is how to do it in a lying down position. Okay, so once you strike the tendon, what is going to happen? There will be contraction of the biceps which can lead to elbow flexion. So you're looking for that elbow flexion. So remember, when you're doing this test, your eyes should be at that on the muscle. You're not you need not check whether there is a flexion of elbow or not. What you're looking for is contraction of the muscle. Okay, and the center is C5 C6. So root value for biceps reflexes C5 C6. Okay, so that will show how to do the biceps jerk. So the next important jerk is a triceps jerk. So how do we do the triceps jerk? So for this we have to keep the elbow flexed at 90 degree and the forearm is supported at the wrist. So you support the subject's forearm at the wrist and then we are going to tap the triceps tendon just proximal to the olecranon process. So see here, this is the olecranon process. Just above that you have to strike the uh, tendon just above the olecranon process. So that is how we can do the triceps jerk. Now what if the person is lying down? In that case, you just have to drag the arm like this, drag the forearm like this and then strike at a point just above the olecranon process. In lying down position, you need not support because the hand is already supported by the body. Okay. So what is your observation? There will be contraction of the triceps muscle here and it will cause extension of the elbow joint. Okay, so your eyes should be on the triceps and see if it is contracting or not. And what is the root value? It is C6, C7. So C6, C7 is the root value for triceps jerk. Next jerk is the supinator jerk. So supinator jerk, it is also called brachioradialis reflex. So to elicit this jerk, we keep the elbow in a semi-flexed, semi-prone position like this, in a semi-flexed, semi-prone position, and then we support the forearm. Okay, and then we have to strike the tendon on the styloid process of the radius. So see here, for this jerk you're not placing your thumb. Okay, unlike biceps jerk, for supinator jerk you're not placing your thumb, you're directly striking it over the tendon just above the radial styloid. So this is how you'll do the supination. And what are we going to observe? We're going to observe a slight supination due to contraction of the brachioradialis muscle. Okay, and the root value is C5, C6. So that will complete supinator jerk. Next, a very important jerk is the knee jerk. So we have to know how to do this knee jerk. Again, it's a very common auspiciation. So to elicit the knee jerk, we can ask the subject to have in a sitting position with the knee flexed and leg hanging freely like this. So the leg should hang freely by the side of this cord, and then we have to ensure that the muscles of the limb are relaxed, and then you have to palpate for the patella. See, it's a knee jerk is also called the patellar reflex. So we have to palpate for the patella and tap the patellar tendon. So it is just behind or just below the patellar tendon. Patella, we have got the patellar tendon, so you can strike there with the knee hammer. Remember, in this case, you're going to hold the knee hammer upside down. Okay, so you can just tap the tendon just below the patella like this. Okay, now if it is in a lying down position, you have to lift up the knee like this. So suppose the person is in a lying down position, you have to lift up the knee like this, and then you have to palpate for the patella, the quadriceps tendon, and then strike just below the patella. And what are we going to observe? We are going to see that the leg is being jerked up due to the sudden contraction of the quadriceps. So the quadriceps muscle here will be contracted, which will cause jerking up of the lower limb. And what is the root value? It is L2, L3, L4. L2, L3, L4 is the root value for knee jerk. So now we'll see how to elicit the ankle jerk. So to elicit the ankle jerk, we have to position the lower limb in such a way that there is flexion at the hip joint as well as the knee joint. Okay, and then we have to evert the foot. You can see that the examiner here is catching hold of the foot and slightly everting it. Okay, so that the ankle is dorsiflexed. And then we strike over the Achilles tendon here using a knee hammer. So remember, it should be flexed at the hip, flexed at the knee, and then you have to dorsiflex the ankle and then strike over the Achilles tendon. Okay, so this is how we have to do an ankle jerk. Now, how will we do it in a sitting position? So, do it in a sitting position. You can ask the subject to kneel down on the chair. So, you just have to place the leg on the chair and you can strike over the Achilles tendon using a knee hammer. Remember, here also you have to dorsiflex the ankle. You can see that the examiner hand here is dorsiflexing the ankle and then striking over the Achilles tendon. So in this case, we are observing for the sudden contraction of the calf muscles, which is going to result in a plantar flexion of the foot. So the effector is going to cause plantar flexion of the foot, and the center is S1, S2. So for ankle jerk, the root value is S1, S2. So that will complete all our deep tendon reflexes. Now, what is gentrathic maneuver? So suppose we are not getting a reflex properly, then what you can do is a gentrathic maneuver. So gentrathic maneuver basically means we are trying to reinforce the reflex by means of methods like clenching the teeth. So for example, if you're doing a biceps jerk, if you're not getting it in the first go, we can ask the subject to clench the teeth and check if the biceps jerk is present or not. If you're doing a lower limb reflex, you can also ask the subject to hook the two fingers and then pull it on either direction. So in this case also you can enhance the reflex. The gamma efferent activity will be increased and thereby it can reinforce the reflex. So gentrathic maneuver is something that we do to reinforce the reflex. So for the examination you have to first we have to do it without the gentrathic maneuver, and if you're not getting the reflex you can try it with reinforcement whether you're getting it or not. And also, you must not forget to check for clonus. So what is clonus? Clonus is a regular series of alternate contraction relaxation of a muscle following sudden sustained stretch. So basically there will be alternate contraction and relaxation of the muscle. When we suddenly stretch, when you give a sudden sustained stretch. So why should we check for the clonus? Because remember in the grading we had a 4 plus is hyperreflexia plus clonus. So if you feel that the person is having hyperreflexia, then you have to check for clonus also. So clonus can be elicited in conditions with exaggerated tendon reflexes such as pyramidal tract lesions. So there are two types of clonus. First one is called the patellar clonus. So to elicit the patellar clonus, you can ask the subject, ask the subject to keep his knee extended, grasp the patella firmly, and then give a sudden push distally and maintain the push. So see, you're first going to feel for the patella, and then you're going to give a sudden push and maintain the push. Okay. So what will happen? If there is clonus, there will be upward and downward movement of the patella due to the clonus of the quadriceps muscle. There will be contraction and relaxation of the quadriceps muscle, which will cause the upward and downward movement of the patella. So that is called patellar clonus. Another clonus is called the ankle clonus. So to depict the ankle clonus, you have to support the patient's leg with knee in flexion and ankle resting in 90 degree. Okay. So in this position, you can ask the subject to keep the leg, that is a knee and ankle in a 90 degree position. And then you suddenly dorsiflex. Okay. You're going to briskly dorsiflex and partly invert the foot. And you're going to sustain it. So you're going to suddenly dorsiflex the ankle and then you're going to keep it like that. So if there is clonus, there will be repeated beat of the ankle in the dorsiflexion and plantar flexion. So the ankle joint will be moving up and down like this if there is clonus. Okay. So your examination will be complete only if you check for clonus also. And finally you have to report to the examiner what your findings are. So suppose if you are asked to check for biceps jerk, then you have to report to the examiner whether the biceps jerk was normal or what the grade is. Okay, so that will complete your examination of reflexes. So I hope this will be useful for you. Thank you.